Hello everyone. Today we are going to discuss upper limb tension test. First we are going to start with brief anatomy for brachial plexus. Okay. Brachial plexus consists of following parts. Okay, the first one is the roots, then there is trunk, then there is divisions, and then there is cords, and cords are divided into branches. So first let's see roots. So roots, it encloses from C5 to T1. So total roots are C5, C6, C7, C8 and T1. Okay, the roots are conjoined, they joint as they go forward, and they forms the trunks. So trunks are superior, or you can call it upper or superior, middle, and the inferior or lower one. Then there are division. Each trunk divides into the anterior and posterior division, anterior and posterior. Okay, so each trunk will divide into anterior, posterior, and then divisions will combine again to form the cords. Okay, so basically roots encloses C5 to T1. Okay, trunks are upper, middle and lower. Upper is formed by joining the roots of C5 and C6. Middle is only C1 and lower is C8 T1. Okay, and divisions, each trunk will divide into anterior and posterior division. You can memorize it by Randy Travis drinks cold beer. So it's roots, trunk, division, cords and branches, or you can say terminal nerves. Now we'll see how the cords are formed. Totally 3 cords are there: lateral, posterior and medial. Okay, divisions are anterior and posterior. All posterior divisions will combine and form the posterior cord. Okay, so posterior cord is the simplest one, formed by all posterior divisions. Okay, and then two cords, that is lateral and medial. So medial is combined only, median is only anterior division of lower cord, so there is no other combination with it. Okay, so these two are easy, posterior and medial, and the lateral one is the last two remaining anterior division of upper and middle. Okay, so anterior, this one anterior, upper and middle anterior divisions combine and they will form lateral. All posterior will form posterior cord, and the anterior of the lower trunk will form the medial cord. And lastly, the nerves. For the memorizing the nerves, we will remember as lateral cord. For the memorizing it, we will remember LML letter. For posterior cord, we will remember star, and for the medial cord, we will memorize M for U. Okay, so for the branches, lateral cord, LML, that is lateral pectoral, lateral root of median nerve and musculocutaneous nerve. Then for posterior cord, we will remember star, so STAR. Okay, subscapular, upper and lower nerve. Then T for thoracodorsal, then A for axillary, R for radial. And for the medial cord, that is M for U or 4MU. Okay, so medial pectoral nerve, median cutaneous nerve of forearm, medial cutaneous nerve of arm, and medial root of median nerve, and lastly the ulnar nerve. We will start with upper limb tension test now. We will start with ULTT1. ULTT1 is median nerve bias. For that, we'll hold the shoulder in depression, and then we'll take into 110 degree of abduction. We'll bend the elbow till 90 degrees. Okay, and then we will add wrist and finger extension, and then we'll add lateral rotation and then extension of the elbow. Then we'll ask the patient to bend the neck sideways. Bend your neck sideways. Okay, and then we will add, as we go for each step, we'll ask the patient if the symptom is provoked or not, and we will test it first on the good side and then on the affected side. Now we'll test for ULTT2. For the ULTT2, we'll depress the shoulder again. Okay, and then we'll do 10 degree of abduction. Again, we'll supinate the forearm, so the forearm will face up, and then we'll extend the wrist and extend the fingers like this, and then a bit of external rotation. This will, and for the last step, we will ask patient to bend the neck sideways. This test again will check the axillary nerve and musculocutaneous nerve and median nerve. This is ULTT2. Now for the ULTT3, we are going to check the radial nerve. For the radial nerve, again we'll depress the shoulder first. We'll take into 90 degree of abduction, elbow flexion for 90 degrees, and then we'll supinate the forearm, bend the fingers, we'll extend the elbow, and then we'll ask the patient if the symptom is provoked or not. And for the last step, we'll ask patient to bend the neck sideways. This is ULTT 3. And the last one is ULTT 4. ULTT 4 for ULTT 4, we will check the ulnar now. Again, the patient's position is supine lying. We'll depress the shoulder first. We'll take into 90 degree of abduction. Then we will bend the elbow for 90 degrees, and then we'll extend the fingers and the wrist, and we will take this one to the patient's head. So basically we are taking the hand to the patient's head or face, and this is for ulnar now. Okay, and for the last step, again we will ask the patient to bend the neck on the sideways. So if in this ULTT, that is 1 2 3 4, we will add the components one by one, and if the patient feels pain or any paresthesia, that is symptom is provoked, then we will stop the test at that point. We'll ask the patient to bend the neck to provoke the symptom more, and if we are going to go for side flexion on the same side, the symptoms will be less. So neck side flexion is a kind of sensitization that we are adding over here, and we'll do on the good side first, so patient can know what are we doing, and then we are going to do on affected side. So ULTT 1 is for median nerve and anterior interosseous nerve and root C5 to C7. ULTT 2 is for median nerve, axillary nerve and musculocutaneous nerve. ULTT 3 for radial nerve, and 4 for ulnar nerve. Basically these all neurodynamic test gives stretch to the nerve. So if nerve is stretched, and if there is some kind of pathology going on in between nerve course, it will provoke the symptoms. So patient will tell you the symptoms. That's it. Thank you.